So carpal tunnel syndrome is basically, it's a compression of the nerve. It's called the median nerve as it runs through a little space through the wrist. And what runs through that space is the tendons that bend your fingers and the nerve that supplies sensation primarily to that part of the hand. All sorts of things can cause it, but the problem is still the same thing, which is that nerve getting squashed. The symptoms of carpal tunnel primarily are numbness, pins and needles in the fingers, often at night time. And that's because of compression of the nerve. But the nerve runs from here right up to the neck. So that same nerve is running all the way. And if you think of a nerve as being a little bit like a hose pipe, it's rather a simplified version of it, but it doesn't matter where you stand on that hose pipe, what comes out the end is the same. Once you've identified that, yes, it's carpal tunnel syndrome, then there's a whole spectrum of treatments. We start with very simple things like night splints, sometimes some exercises and some stretching, and for some patients that will be enough to settle things down. Failing that, the next stage would be to consider, for example, steroid injections. That, for some patients, can fix the problem. For others, works very well as a diagnostic, can improve things for a while, but then unfortunately the symptoms come back. If that's the case, then we're talking about doing surgery. The surgery is relatively straightforward surgery. It's very common. It's done under a local anaesthetic, and it's a small cut, runs from about there to there. Find the bit that's tight and release it, and that basically takes the pressure off the nerve. From day one, fingers are free, so they can use the hand for light activity, but no heavy lifting. So within 10 days or so, you can start getting it wet, you can start using the hand as normally as you feel, but it is going to be tender, it's going to be sore for a while, particularly around here. You're going to know you've had it done probably for a good 6 or 8 weeks, particularly if you're doing heavy manual work. There is a whole spectrum of treatments that are available for this, and that it's not something they have to sit there and suffer with. Actually, the longer they wait, particularly if they're getting permanent symptoms, then they are at a slightly higher risk of getting permanent damage to the nerve. So they're better to try and get on and do something sooner than waiting and getting persistent problems.